Good afternoon, folks. This is Robert Chappell, Executive Editor of Madison365, with your daily update for Tuesday, July 27th. Before we get into it, we have to mention our sponsor for today, Community Shares of Wisconsin, celebrating their 50th anniversary with more backyard heroes and recognizing them. Community Shares of Wisconsin marks its 50th anniversary, recognizing volunteers and leaders with Anniversary Backyard Heroes Awards. Denise Matika and Nicole Gotthelf provided the leadership and vision to merge two nonprofit organizations into Community Shares of Wisconsin, where they served together as co-executive directors. Denise continued her leadership as a board member, provided mentorship and advice to staff during her entire tenure. Nicole shared her leadership not only with other CSW member nonprofits, but with the larger Madison community, going on to serve 8 years on the Madison Common Council. Thank you to the Anniversary Backyard Heroes. And we thank Community Shares Wisconsin for their support of the update in Madison365. Now, it feels a little bit today like a day back in September or even in March of 2020, where there's just a lot happening. Like, you know, we've felt this coming, right? We felt like numbers are getting higher, things are getting worse. And now suddenly the institutions are reacting. So we've got kind of a few things to tell you. It's not going to be like in last March when it was like every day there were like 8 cancellations we had to announce and more government funding things and more government shutdowns and all that kind of stuff, or new health orders. We're not there at this moment, but it has been kind of a crazy day. A couple of things. Let's get to the numbers first. We'll talk about the numbers first, and then we'll get into the reactions that have come. We are reporting today in Wisconsin 983 new confirmed cases, which is the most we've seen since April, right? Now, what's that? How does that compare to a year ago? A year ago on this date, the 27th, was almost the same. 915 new cases. So actually more cases today than a year ago today. The average, oh no, I'm sorry, that wasn't on that day. That was the 7-day average a year ago today was 915. Today, the 7-day average is 419, which is kind of a lot. More than we've had. It's lower than a year ago, but if this trend continues, the 7-day average could be over 900 a week from now, right? If we're 983 today, if that number holds up, 7-day average could be over 900 a week from now. Also of concern, positive test rate, which is the percentage of positive tests from the past 7 days, is now 4.6. That was 4.1 yesterday, right? It went from 3.3 to 4.1 to now 4.6. A year ago, it was 5.5. So it's a little lower than a year ago, but not by much. Now, that positive test rate might be a little bit misleading. Right? It's accurate. 4.6% of all the tests in the past 7 days were positive. However, it is very likely that right at this moment, we are getting fewer people tested than we were a year ago. Right? There's no line energy center open. People aren't in that mode of getting tested all the time. So the people who are getting tested are either experiencing symptoms or are the ones that are sort of normally just get normal surveillance, like healthcare workers, right? So if we had more people getting tested just as a routine thing, like either just I'm going to do this once a month, or I went to an event, I went to a party, I went to a thing, so I'm going to go get tested. If we had more of that, we would presumably have more negative results, one you'd hope, and the percentage of positive then would go down a little bit. So a high positive test rate is sometimes an indicator that you're not doing enough testing, in addition to being an indicator of you have too much virus out there. It's kind of both of those things. Still, 4.6% is bad. We need that to be below 3. Right? And the fact that it's gone up very quickly is a problem. Like, it was moving for the past several months, it's moved a tenth of a point a day. Now it's gone up over a full percent up in the last 4 days. Now, this has not yet translated into a surge in deaths. That's the big concern. That if you have a surge in cases, that you'll have a surge in deaths 4 weeks later. Our surge in cases is only a couple weeks old right now. So, we don't know yet if it's going to produce more deaths. Right now, we're only seeing 2 deaths per day, which is, not good. We'd rather see 0. But if this surge of cases produces the same result as the surges of cases in the fall, we would expect the death rate on a daily basis to go up to like 9 or 10 in the next 3 weeks. It's possible that won't happen, right? Because the people who are getting sick now are vaccinated or are younger, and therefore less likely to die from it. We're also seeing a slight increase in hospitalizations. We're down a little bit from yesterday. 186 people hospitalized today. That's 8 fewer than yesterday, but it's 42 more than a week ago, right? So hospitalizations also continue to rise. Meanwhile, vaccinations have still not really moved very much. About a tenth of a percentage point for each of those as well. 51.6% of us have gotten 1 dose. 49.1% of us have completed the series. That's not enough. We now have 29 counties with what's considered to be high case activity, based on like infection per capita. 38 are medium and 5 are low. So most counties in Wisconsin, almost all the counties in Wisconsin, are either medium or high transmission rates. Also not great. So what's the reaction to all of this? Two big things. The CDC recommends that everybody put a mask back on indoors if your county, if your area has high disease activity. Dane County, as cautious as ever, is recommending, is going a little bit above and beyond that, not much. Dane County right now is medium activity rate. So the CDC wouldn't necessarily say, Dane County people have to mask up. But Dane County is saying you should probably mask up. Now, it's not everybody. The CDC is saying if you're vaccinated, okay, let me back up. The CDC's recommendation is if you are not vaccinated, mask up. If you're vaccinated and have regular contact with unvaccinated people, then you should mask up when you're indoors away from home. Right? So what does that mean? It means if you have kids at home who can't be vaccinated yet, you should be wearing a mask at work. You should be wearing a mask to go to the store. You should be wearing a mask to do just about anything else indoors. Outdoors is not a worry, apparently. The thinking is that if you are vaccinated and you breathe in some of that Delta variant, right, it may or may not make you sick, but you could carry it home to your kids who are more likely to get Delta than they are to get any other variant. So to protect your unvaccinated family, you should wear a mask when you're out and about. Basically, what Delta variant does, my understanding, my very amateur journalist understanding, is that it just creates a lot more of itself. Like they talk about viral load, which is kind of a gross word to me for some reason, but it's like the physical amount of virus that's in your body. When you have Delta, it's about 1,000 times higher, which means there's just more particles of virus in your body for you to breathe out. And it replicates itself so fast that even if when you're vaccinated, your body creates an immune response, right? So if I'm vaccinated, I breathe in some COVID, my body kicks into gear, produces the antibody, fights it off, and it's done. And I don't breathe it on anybody else, and it just kind of dies off in my body, right? The problem with Delta is it's replicating faster than your body can respond to it, right? So your body, if you're vaccinated, your immune response will mitigate it, will knock it back a little bit, but it will take a little bit longer to actually kill it, during which time you can spread it. So CDC says if you are in regular contact with unvaccinated people, you should mask up indoors. Good questions. I'll get to the questions in just a second. First, Jaleesa's question, has Dane County mandated masks yet? No, and I don't think they will. What they've done is, this is, and your question perfectly anticipated where I was going next, because CDC made all these recommendations in Dane County, even though Dane County is medium activity, and CDC would not necessarily recommend masks for everyone indoors. Dane County is saying masks for everyone indoors, recommended, not mandated. Basically, the idea is, let's just keep it simple. Everybody, when you're indoors, put a mask on. Even though we have 70% vaccinated here in Dane County, we are seeing an increase in cases. A month ago, we were at like 7 cases per day in Dane County, and now we're at like 31. Right? Still not crushing, still not terrible, but let's keep it that way. Let's stop it there. You know, everybody mask up until we get through this crisis. This is a good question. Are there specific counties or areas driving statewide data? Unfortunately, because everything was so good, we haven't really been keeping up with the county by county data, and we're going to start doing that again. So I can't tell you this for sure right now. I will be able to in a couple of days. I can tell you Dane County is 70% vaccinated. Milwaukee County is, over half. And it's mostly the rural areas up north that are less vaccinated. So I would imagine that that's driving a lot of the spread. But also, Delta is pretty indiscriminate, right? And is more or less evenly distributed. Greg wants to know what will be required for the Echo variant. Okay, first of all, it's Lambda is the variant that's already out there. And here's the thing. There's this idea that like whatever the next variant is will be worse than Delta. And that's not really how it works. Okay. Lambda, which is the next one after Delta, is already a virus of interest, or is a variant of interest, not even a variant of concern yet. Variant of concern. Because all a variant is just something different. Okay? It's just mutations aren't always good or bad. It's just a slight change in the genetic makeup of the virus. It might be worse, it might be better, it might just be slightly different. Right? So don't assume that Lambda and Gamma and I don't know what else, I don't know the Greek alphabet that well. Don't assume that those variants are going to be necessarily automatically worse than Delta. If there is one, if we get to Theta, I don't know, and it's worse than Delta, like I honestly don't know. Like things are worse now than they were when we shut down schools. And when we instituted the first round of health orders, when that first Safer Wisconsin plan back in March, like March 25th or whatever it was last year. Things are worse now than they were then. So, it would not be out of the realm of common sense to take some drastic measures right now, but it's not going to happen. The Supreme Court has, the Wisconsin Supreme Court has made sure that we'll never again get any sort of government mandated health order, unfortunately. And let's get to vaccines. we'll never get required vaccines for schools or required vaccines for UW schools because the state legislature will threaten those budgets. They will say things like, I'm sure they have said things behind the scenes, like if you require vaccines, your budget will be cut. However, I was listening to The Daily this morning, which is one of my daily podcasts that I listen to. It's the New York Times daily news podcast. It's usually pretty good. Not always. It's got some problems. But today, they were saying that there's no way that the Biden administration is going to require vaccines for federal workers. Like, it's almost impossible for the federal government to require vaccines for everybody. But you can require vaccines for your employees. You can require vaccines to go to school. You can require vaccines, to serve in the military. But they were saying that the administration feels that mandating it will just cause more people not to get it, because they'll just be like, just trying to prove a point by not getting it. An hour later, I see that the Biden administration does in fact plan to require vaccines for all federal workers, and they're going to announce that on Thursday. I don't know when it would begin exactly. But think about federal workers. Think about the federal workforce. It's a lot of people. Right? You got the federal courthouse downtown in Madison. You've got the federal courthouse in Milwaukee. You've got every postal worker, every post office in every city, every village in town. You've got the Social Security offices, right? You got all sorts of federal agencies that are spread out across the state, and all of the states. And all of those people, they get also the Veterans Administration hospitals. That's the big driver of this, actually. The VA earlier today announced that it would be required for all VA employees, because there was like 30% of the VA, especially the healthcare workers, who weren't getting the vaccine. And obviously, if you're taking care of elderly people in the VA hospital, you should be vaccinated. Like, that's just kind of obvious. So despite the idea that, politically speaking, the Biden administration would be very hesitant to require vaccines for federal employees, they have decided to do so nonetheless, which I hope prompts other institutions. Cruise lines are requiring vaccines, right? Other states could require vaccines for their workers. Governor Evers could require vaccines for all state employees here in Wisconsin, for example. And that's not out of the realm of possibility. It would probably get a court challenge. Who knows? Whatever. But vaccines is what's going to stop this. We know that. But it's getting bad. It's going to get worse. And we hope just to ramp up. We do see that on a nationwide basis, vaccines are getting done faster now. There's a new sense of urgency in the last few days. So we'll see if that translates into Wisconsin. It hasn't yet. We'll see. So fingers crossed. Hold your breath. We're going to take a short pause, 15 seconds. I'll be right back with some more news for you from all over Wisconsin, from Green Bay, just a few more minutes. So don't scroll away. Give me 15 seconds. I'll be right back.
Hi, my name is Megumi. I serve at AmeriCorps because it is the perfect opportunity to work with middle school students and to grow in important skills such as leadership, responsibility, and communication. You can serve too. Learn more and apply at www.passamericorps.org.
Thank you for sticking with us. We are back, and today we published our second installment of our our most influential Native American leaders list. Today we have Edmund Manydeeds there on the left. He's the president of the UW Board of Regents. He's an attorney in Eau Claire. We have the president of the Lac du Flambeau, John D. Johnson. We have Brandon. I'm sorry. I don't want to say his name wrong. Brandon. No, I'm sorry, not Brandon. Brandon is later in the day. Dylan. We have Melinda Danforth and Alice Scannendor, Dylan Jennings. I almost said Brandon Jennings. He used to play for the Bucks. Anyway, these are folks some of these folks are leaders within their native communities, like John D. Johnson and Melinda Danforth, and other people are leaders outside the nations, where they're active members of their nation, but taking leadership roles in the broader community, like Edmund and Dylan. So and Alice for that matter. So keep an eye on that. You can get to know all these folks right now at Madison365.org. That's part 2 of our 5-part series. So there's another section yesterday, and there will be more tomorrow and Thursday and Friday. So get to know those folks. So often we talk about Native American culture in the past tense, like we remember Native American culture, but Native American culture is right here, right now, among us. It's like right next door to us. So it's nice to lift those people up. I've been in Green Bay for a couple of days. If you saw the show yesterday, you saw me in my little hotel room in Green Bay. The reason I was there was to cover this meeting of the Racial Equity Ad Hoc Committee for Brown County. This is the chair of that committee, Dr. Pooja Bambra Arora. That's the 4th meeting of that committee. The rubber's starting to hit the road. They're starting to get some actual thoughts on paper and some recommendations, and they're going to put together a report by the end of the year. But the theme that came out of this meeting was that, there exists an infrastructure, a nonprofit infrastructure that is intended and that works every day to reduce racial disparities, yet the racial disparities still exist. And in fact, the chart here that she was showing, this is difficult to believe, but it's true, that white people, and this is just for Brown County, but it's true across the state. In Brown County, white people on average, the average age of death for a white person in Brown County is 75. The average age of death for a Latino person in Brown County is 44. For Black people, it's 45. For Asian people, it's 59. And for Indigenous people, it's 61. That's really bad. So how do you begin to wrap your head around solving that problem? So that's what they're working on up there right now in Green Bay at this ad hoc committee. Also today here in Madison, and this actually took place yesterday. We got the story up on it today. The bill to deregulate natural hair braiding has been signed into law. So it used to be that if you wanted to braid hair, which is like a really standard practice in African American communities, to braid hair, natural hair, you have to, if you wanted to do that as a business, which a lot of Black women do, you had to have a cosmetology license, which is a massive impediment. It's like a really expensive thing to do. If you're not running a cosmetology studio, you're not a barber, you're just braiding natural hair in a natural way. So Sheila Stubbs and Latanya Johnson and some other folks pushed this through the legislature. It got bipartisan support. It passed both houses and is now signed into law. So that if you want to run your own business from your home or from a salon braiding natural hair, you can do so without the onerous requirement of a license. Turning now to national news, we told you the other day that the Cleveland baseball team is now going to be known as the Cleveland Guardians, much to the chagrin of racists everywhere. The football team in Washington is going to change its name. We don't know to what yet. The Kansas City Chiefs, however, are not going to change their name. However, they are going to retire Warpaint. Warpaint is the very racist name of this horse, their mascot. The Warpaint was revived recently after a 20-year hiatus for the team's 50th anniversary, and they're no longer going to do that. Now, they used to, back in the day, they had the guy riding the horse was also like dressed up. The CNN story says that the mascot riding Warpaint would be dressed up in traditional Native American garb. I doubt that to be the case. I think the case was that he was dressed up in what white people thought of as traditional Native American garb, right? Feathers, a bunch of paint on her face, various leather things. That probably had very little to do with actual indigenous culture, but like what we thought indigenous culture looked like, which is worse, probably, right? So the Chiefs are sort of the last, I think, of the. Oh no, they're not. The Braves, the Atlanta Braves, also need to change their name. So in the NFL, it's the Chiefs. In Major League Baseball, it's the Braves. In there's a handful of college and a whole bunch of high schools who still need to get on board with this. So we'll keep everybody keep pushing. I guess that's all we can do. All right. Last thing I'll mention today is I'm seeing once again we're back in I feel like we're back in like oh no mode with COVID, right? And just dying, like desperately wanting more information. And we are going to continue. We've stopped doing the daily, tally because it became really almost traumatic every day. But we're probably going to start to revive that. I'm going to keep coming to you here. We're going to continue to keep you apprised of the situation, and that's really important to do. And it's really, really important that you don't have to pay for that. Right? If we had a paywall or if we had a subscription service, like only the people who could afford to pay us $10 a month or $5 a month or whatever would have access to that information, which the information is life-saving in some cases. So we will, it's like our moral and ethical code that we will not charge money for the news. However, it still costs us money to produce it, right? It's free to you, but it's not free to us. So I want to urge you, if you are the type of person who could pay for a $5 a month or a $10 a month or a $25 a month subscription, you can do that. And that allows us to keep it free for those who can't. And the program is called, where is it? The FAM. If you go to Madison365.org/thefam, it's a couple of clicks. You get to, you'll get a few perks, right? You'll get like, when we announce our next leadership summit, you'll get that ahead of everybody else. When we do our power lists later in the year, you'll get those ahead of everybody else. Lorraine, thank you. So if you can, join the fam. Be a member of our family. I'm going to, I just realized my little overlay here is covering up the URL. So I'm going to get rid of that. There you go. Madison365.org/thefam to join. It's a monthly subscription. It's $5, $10, $25, whatever you can do. And that helps us to continue to create this news because there's going to be more, right? It makes us really busy. And it makes us have to, the journalism you see on Madison365 is produced by professionals, and we pay them as such, right? Plus, there's a lot of traffic on our website. People come to our website a lot for this information. That costs money to keep that up. Like literally, like just for the server time and the server space to keep the website up costs us several $100s a month. Not a complaint. Just saying, we need some help to keep it going so we can keep growing and continue to bring this important information to you and to keep it free for those who can't afford to pay for it. I want anybody off the street, homeless person, person experiencing homelessness, to corporate CEO, to be able to go into the library, punch up our website, and be informed for the day with no impediment in regards to cost. And the only way that continues to happen is if you all can chip in just a little bit and be a member of our family. Okay, that's all. Yes, Lorraine. I'm going to put the link in the comments. I think Lorraine speaks for all of us. Oops. When she says, I am the hero here. I'm not. I'm not a hero. I am a journalist. And it's a noble profession. We get maligned quite a bit these days. We always have. And that's, this whole fake news thing isn't new. Like, people have been giving that to us for years. And I've been in this business a very long time, and it's I'm proud to be in this business. And I'm proud to bring you the news every day, and I'm proud, even more proud, to mentor and help create opportunities for young people of color to come into this business, which for my whole career up until we started 365, the entire profession was white. Like I never had a black coworker until I created a place, until I helped create a place to have black coworkers. Right. And we have several alumni of our programs who are off in graduate school or off working at NBC News, Capital Times, other places. So we are trying to diversify the mainstream media. So all that is worth supporting, I think, and it's worth being a part of our family and joining the family. So I will quit with the pitch. Take care of yourself. Put your mask on. Get your vaccine. And come back tomorrow. I'll be back at normal time tomorrow, 4 o'clock, to get up to date on everything. And we'll see you then. Until then, have a great evening.
This is 365 Media.